Good morning. Today we are working in dermatology, which I usually love to work in dermatology. The only downside is that they start super early. So it's 6:30. Let's get going. If you're new here, my name is Olivia. I am a float medical assistant and I travel to over 150 different clinics to cover for people. I don't film at work for privacy reasons, but I promise I will tell you all about it when I'm done. So see you in about 10 hours. I forget how much I love working in dermatology for several reasons, but I think one of the biggest is that time passes so quickly. It's been 10 hours since I last talked to you guys, and I would say my internal clock feels like it's been maybe 3 or 4 hours. It's just crazy how fast time flies when you're super busy. But yeah, let's get into it. So, as a float medical assistant in dermatology, I definitely am not doing everything that the normal MAs are doing. I'm mostly just rooming patients and then kind of handing it off to the normal MAs because they scribe for their provider. And I've been in a lot of different dermatology offices and they always have the MAs scribe. I haven't seen one yet where they don't do that. And I think that's just because it's such a fast-paced clinic. They see patients in 10-minute increments, which is just crazy to me. Normally, I would say that's way too fast, like you need more time with the provider, but all of the patients are super happy with this provider, and even if they have like multiple concerns about their skin, she somehow addresses it all in that time and like does all her biopsies and everything. So basically, I don't know how she does it, but that is one thing about dermatology. In general, it is extremely fast-paced. But like I said, I think that's awesome because it makes time pass quickly. So in 10 hours, give or take, we saw 36 patients, and that is including over an hour lunch break. So if you work in outpatient settings, then you'll definitely understand that is a lot of patients. If you don't, to put it in perspective, like a typical primary care doctor that I work with sees between 16 to low 20s. Lots of time in dermatology, the doctor will also perform Mohs surgery, which is essentially where if you have skin cancer, they slowly take layers of skin off and look at it under a microscope while you're still in the office to make sure that they're getting all of the cancer out. And once they look and it has no more cancer, then they stitch you up. And that's kind of cool because you can do that in clinic instead of having to like be put under and all that, so that's nice. The other doctor in the office does do Mohs, so this provider usually refers a lot of them over to him. But yeah, if you're looking into dermatology, a lot of times MAs will also help with Mohs surgery, so it just depends on where you work and who you work for specifically, but this specific provider just sees patients. She does not do Mohs. One thing that I think is really cool about being a medical assistant in dermatology is that most clinics, you will be the one numbing the patient, so injecting lidocaine before they do shave biopsies or punch biopsies. And I think that's just a really cool scope of practice because like me as a float, I'm not allowed to do that. Or even in like an urgent care setting, the provider usually numbs before laceration repair. So I think that is definitely something that's cool about working in dermatology as a medical assistant. But yeah, basically what I did today is I roomed every single patient, and in between patients I would clean the room, put the laundry away, reset it. They have these trays set up for every room in a very specific way with all the supplies they would need if they are going to do a biopsy, because more often than not they do. So I'd make sure all the supplies are back out, replenish, clean up, and then take back patients super quickly. Then I would give them a report of what the patient was here for, then they would go in with the provider and scribe, and it just kind of went boom, boom, boom like that all day. I only did a handful of vitals. That's another thing that's a little different. I did get a weight on every patient. I did get a blood pressure on a few, but there's really not much need for taking vitals in dermatology, which makes the rooming process a lot quicker. So do with that what you will. I feel like that's a pro for some people and a con for others, because vitals can be fun, but that is what it is. But yeah, as far as what we saw, lots of total body skin exams. So that's where I have the patient change into a gown. The provider comes in and just does a head to toe super quick check to make sure that there's no concerning areas on the skin. This is something that I think is really important to do, because even if you are checking yourself for concerning areas, there's some spots you can miss, and yeah, it's just a great precautionary thing. We did see some people for rosacea, which, to be honest, I don't know a whole lot about, but I know that it's reddening of the skin, usually on the face, and it can be painful, but a lot of people look like they just have super, super rosy cheeks, and sometimes it's rosacea. Lots of people come in for acne, especially teens and young adults, and we do a lot of Accutane follow-ups, but there are honestly lots of different ways to treat acne, so I saw a lot of that today. We actually see a decent amount of alopecia, so hair loss, in both men and women. I remember when I first started working in dermatology, that was something new to me. I didn't realize that that was something you would go to a dermatologist for, but now it kind of makes sense. And then we also see quite a few warts, and they can literally be anywhere on the body. Sometimes they're just super stubborn, require a series of treatments before they go away. But yeah, I would say that is a pretty good summary of what at least I see when I work in dermatology and what the provider treats. Overall, I'd say it was honestly a great day. It went by really fast. I got off a little bit early. The only downside, and this is being super nitpicky, is that I had to wake up before 6 a.m., which I would even consider myself a morning person, and that was hard for me. But again, I feel like you can do anything as long as you are consistent with it. So, and that's not to say that every dermatology office starts super early in the morning. We have some exciting things for the rest of the day. First, I'm going to pick up some photos that I had printed. Then I'm going to go to the gym, and we're gonna hit WOD day, and then I have a Friendsgiving. So come along for the rest of the night. It should be fun. This is not all related, but I just had to show off my cute little Christmas village that I set up last night. We've got the lights and all the little houses and the ice skating rink, and then I love this shelf because there's a sledding hill. Anyways, how fun is that?